Good afternoon. We're gonna start. So in this symposium, we're showcasing our epilepsy specialists, our epilepsy team at Riley Children's Health. We have 5 experts who will be sharing with you their expertise in various areas, specifically refractory epilepsy and how and when to refer the patient to us and what to do when faced with a new diagnosis and then with refractory seizures. So our first speaker is Dr. Miller. Dr. Miller, I'm going to do my own introduction, is an assistant professor at Indiana University and Riley Children's Health. He is board certified in pediatric neurology and in epilepsy. He completed his neurology residency and epilepsy fellowship at IU. Dr. Miller is known to be a compassionate, energetic epileptologist and a real team player who greets you always with a strong work team. And he's loved by his families and his colleagues. His research focuses on the medical, dietary, and surgical treatment of the epilepsies. And he will speak to you today about the approach to a first seizure. Dr. Miller, the floor is yours.
All right, well, thank you for that introduction. So my presentation is about seizure first aid and what to do afterwards, kind of for the generalist and also for the neurologist too, I suppose. And just thinking through how do we take care of patients if we encounter them in the field having a seizure. So this is what I'm supposed to show for the CME. I'm supposed to keep this up for 5 to 10 seconds. So I'm gonna leave it for hopefully 7. Then we'll move along. So I think, yeah, this is worth two credits. Fantastic. All right, so just know that I ripped pretty heavily from the Epilepsy Foundation website on this. They actually have a lot of really good resources for seizure first aid and seizure safety, just so you know. They have their own course. It's about an hour long. I happened to look at it today. It's actually very good. It's a very high production value, cartoony kind of thing, but they throw in pretty much all the bullets you need to know about seizure first aid and seizure safety, I would say. We also are going to have a seizure safety book with a QR code that's coming very soon. We don't have the QR code today, but if anybody's interested in the digital copy, I can send that out, absolutely. And we distribute that to patients out of our clinics. So, but just a plug, yeah, if you're interested in a seizure first aid certification course that also has CME with it, Epilepsy Foundation is the way to go. This would be that course, just so you know, and showing that it also has some credit with it. So let's start with a case. We got a 5-year-old boy who's previously healthy. He's noted by his mom and his dad to have a sore throat. He's eating less. All of a sudden he has a convulsion. His parents are like, oh gosh, good thing we took that Epilepsy Foundation course. We know what to do. This is great. The 3 S's. We stay. We make sure the patient's safe. We roll them on their side. Then we call for help if we need it. That's the summary, but we're going to talk through it in a little more detail than that. Basically, if the patient is having a big shaking seizure, a convulsion, or stiffening seizure, we help them to the ground. Make sure they don't hit their heads if you can. You lay them on their side. Why is that? People don't swallow their spit right during a seizure, so you don't want them to aspirate. We place soft things underneath their head and also just make sure they're not going to hit anything that would hurt them. Don't use your hands, though, because you might break your fingers, so just maybe like a shirt or a towel or something like that. Obviously, you know, think about the ABCs, airway, breathing, and circulation. We don't put anything in the mouth. If you put things in the mouth, you're more likely to hurt them, especially causing lacerations or piercing injuries. People don't swallow their tongue. It's not a real thing. Never seen it. Don't think anybody else in the room has seen it either, so that's good. We also time the seizure. This tells us if it's a medical emergency or not. Most people's seizures, if they have epilepsy, are going to be 1 to 2 minutes. Some people do experience status frequently, and if that's the case, obviously if their caregiver's around, maybe they have a different protocol than this, but generally if you call it 5 minutes, you're going to be in good shape most of the time. Again, if the seizure's over 5 minutes, do 2 things. Call paramedics, because first off, you might need medicines to stop this. If the patient has medicine on them, go ahead and administer it, especially if it's Diastat, Valtoco, or Nasolam. Those things are already pre-measured. You can't mess it up. They're ordered by the neurologist or by the generalist taking care of them. They're dosed by age and size, and they're locked to the correct dose. So you can't possibly overdose somebody on those 3 options. That would be the pen here is here we have the Diastat in the upper right panel. Then we have Valtoco, bottom right panel, Nasolam, middle right panel. As you can see, midazolam is a little tricky. It does come as an IV solution, which we draw up and inject using a atomizer, which is on the far left, or far left of your screen. This thing you do have to measure, though. So it's 0.2 mg per kg up to 10. So you have to at least know about how big your patient is, and obviously with that, that's a little trickier. If the patient has a vagus nerve stimulator, you should be able to palpate that in the left upper chest most of the time. We have a couple patients with right upper chest VNS. They'll also come with this fancy magnet, either on a watch or on their person. You swipe it. Basically, you can swipe it every minute if you want. Don't tape the magnet over the VNS. That turns it off. But if you swipe it, you can't possibly hurt them. So go ahead and just swipe it as many times as you need. After seizure ends, you definitely want to stay with the patient. So already you've done the, you've made sure they're safe, you made sure they're on their side, now you stay with them. Why is that? Because they might be really confused for a while. Even if they don't appear to be, the post-ictal state can be hours. Some people wander, so it's actually really, really important, even if they didn't have a big convulsion, that you make sure somebody's with them to make sure they're safe. That's really, really important. Call 911 if they're unresponsive. That's fair, right? I mean, they're not waking up and their exam is abnormal and you don't know who they are. Maybe they have a bleed inside their head or something like that. So obviously call for help if they're not waking up. That's important. Don't allow the patient to eat or drink too soon after. Why is that? Again, they're not guarding their airway well. So if you feed them right away, they might actually aspirate into their lungs and be in a worse place. Obviously identify the patient. If they don't know who they are, maybe like look in their wallet or find their emergency contact, give them a call. If you're worried at all, though, about their mental status, again, just call 911. That's fair. Excellent. So for us first responders who see the patient in the ER, say, we look for reversible causes of seizure: low glucose, low calcium, low magnesium, hypoxia, hyperammonemia, head imaging to find reasons. If there's no reversible cause, no reversible treatable cause, that is, then we as neurologists then debate, okay, is this person's risk of recurrence higher than 60%? If it is, we start them on daily medicines to prevent seizure. We use this EEG and MRI to kind of figure this out most of the time. If they're high risk or unknown risk, go ahead and call us. It's fair. We're happy to see them. We can be found in the call schedule, Am I On? You can also call the hospital operator and ask for the neurologist on call. Here's our clinic number. Here's our fax number. We're happy to see anybody who's needed to be seen. This is that seizure first aid protocol that the Epilepsy Foundation put together. Like I say, very self-explanatory, the 3 S's of epilepsy. Feel free to distribute this. It's easily found on their website. It's actually in 17 languages. So if you need it in Spanish or anything else, it might well be in that language. Wouldn't that be great? Also, we as neurologists tend to fill out the seizure action plan for patients. This is to inform the school and other public places what their seizures are like and also what medicines they have available for those, and also when to give them. Generally at 5 minutes, though some of our patients we actually do give medicines in sequence or at 10 minutes, depending on the duration of their seizure. So this can be especially helpful in cases where things are not perfectly clear. So, strong work. I realize this was only 8 minutes. So we have a little bit of time for a surprise epilepsy safety quiz. So, just poll in the room. What do you guys think about skydiving? Safe or not? Not safe, not in this case, because if you seize in the air, you might actually hit the ground. That would be really bad. So heights should be respected. We got to watch out for heights that are not enclosed. Swimming is safe. False. Yeah, swimming is not safe. Why? If you seize in water, you might sink. That's really, really bad. Most families understand that, okay? So just use those terms. Basketball is safe. I'd say, yeah, it's true. Absolutely. Because you're on the ground. You're generally not going to get hurt. Maybe you're a professional like 5 feet in the air and you land on somebody, that could be a bummer. But for most grade schoolers, I was on the ground most of the time. My vertical wasn't that great. So I let people play most team sports. Obviously, sports with water and sports with heights. And maybe sports where you spar, like if you're fighting each other. Not so sure about that. Gymnastics is safe. That again depends. Yeah, if you're on the ground, like doing a floor routine, that's pretty fair. But if you're on a balance beam, I don't know. Or rings, probably not. So again, it depends on what your family's asking. What can they do? Cross-country running is safe. You know, I'd say true most of the time, but if you're on a trail by yourself and there's nobody else around, that's a little scary. But track is cool. You're on a track, right? And there's lots of people there. So you're always safer in a group. Very, very important to think about. Sprinklers and slip and slides. This is the water safety activity I suggest. Get cool, but definitely don't swim. Cooking with a microwave, definitely true. Cooking with a stove, that again depends, but use the back burners. That's what we tell people, so as not to spill things on yourself. Also, if you have frequent convulsive seizures in the moment, maybe have somebody else with you when you're cooking. Roller coasters, I generally say yes in my clinic. Obviously, that may be a little bit dependent on the seizure type. If they have photoparoxysmal seizures and you think that trees and photic stimulation may induce their seizure, that's another conversation. But for the run-of-the-mill person, I think roller coasters are pretty safe. You're strapped in. Showers, they're safe. Bathtubs, not safe. Driving, ask your neurologist. We're happy to work on this. We're going to get people driving if they're seizure-free for 6 months and they pass a driving evaluation. All right, that's 10 minutes on the nose. Anybody else have any questions about seizure safety or anything else? Cool. We do our best, absolutely. All right, cool. Thank you all.